Hello everyone. This short video is going to be on coagulation cascade and a simple way to remember it. Hemostasis is the mechanism of the process that stops bleeding. Hemo means blood, stasis means remain. The stoppage of bleeding is important when the vessels are damaged. Major steps in coagulation are vasoconstriction, primary hemostasis that involves platelet plug formation, secondary hemostasis that involves coagulation cascade activation leading to a stable clot formation, and tertiary hemostasis which involves clot retraction and fibrinolysis. The primary hemostasis process is mostly a vascular phase that has a triphasic response. One is the immediate reflex vasoconstriction, where an intrinsic response of smooth muscles in smaller arteries and capillaries cause vasoconstriction. Then there is a transient vasodilatation, which is due to prostaglandin, histamine and prostacyclin. And finally, there is sustained vascular contraction due to the release of local autocoid factors from the traumatized tissues and platelets. Examples are fibrinopeptide B, TXA2, epinephrine and norepinephrine. Platelet plug formation. Exposure of endothelial lining and platelets contact release von Willebrand factor that helps bind the negatively charged platelets and the negatively charged collagen together. This helps in the formation of platelet plug. Von Willebrand factor, it's a large glycoprotein crucial for blood clotting. It belongs to a class of adhesive proteins. The key functions of von Willebrand factor are platelet adhesion, wherein it binds to specific receptors on the platelet and helping the platelets to adhere to the site of injury. And then platelet aggregation by forming bridges between the platelets. Then helps in stabilization of factor 8. It carries and stabilizes factor 8, protecting it from premature degradation in the bloodstream. Secondary hemostasis is via coagulation cascade that has 13 known coagulation factors. Factor 1 is fibrinogen, factor 2 prothrombin, factor 3 tissue factor, factor 4 is calcium, factor 5 is proaxlerin or else the labile factor, factor 6 is unknown, factor 7 is the stable factor, factor 8 is antihemophilic factor, factor 9 is Christmas factor, factor 10 is called the Stewart-Power factor, factor 11 is called plasma chromoplastin antecedent factor, factor 12 is called the Hegman factor, factor 13 is the fibrin stabilizing factor, apart from the von Willebrand factor that we just saw earlier. All these factors are usually marked in the numerals, and numerals are usually followed by an alphabet A that indicates that it is in an active form. So the classic coagulation cascade has two pathways which lead to a common pathway. One is the intrinsic pathway, or it's called the PTT pathway, or the extrinsic pathway, which is called the prothrombin pathway. In the event of a vascular injury, both pathways can be activated simultaneously. External trauma activates the extrinsic pathway rapidly by exposing tissue factor, and this in turn leads to quick generation of thrombin. Vascular damage exposes collagen and other subendothelial substances, and this activates the intrinsic pathway. Both these pathways work together to ensure a rapid and efficient clotting response to stop bleeding. The extrinsic pathway provides a quick response to external injury by rapidly generating thrombin, while the intrinsic pathway provides amplification and reinforcement of the clotting process. Though both pathways get initiated with a different mechanism, they converge at the activation of factor 10, leading to a common pathway. It is easy to remember factor 10 as it resembles X or the crossroad. So the activation of factor 10 to 10A along with factor 5, calcium ions, phospholipids, converts prothrombin to thrombin, which is factor 2 becoming 2A. This in turn activates fibrinogen, that's factor 1, to form fibrin, which in turn forms the stable clot. The easiest way to remember the factors involved in common pathway is to remember the currency coins that we commonly use or we have come across. The 10 rupee coin, 5 rupee coin, 2 rupee coin, or the 1 rupee coin. That's factor 10, factor 5, factor 2 and factor 1. Now let us look at the extrinsic pathway or the prothrombin pathway. The extrinsic pathway is activated first and it's initiated by external trauma that causes blood loss from the vascular system. Tissue factor or factor 3 are exposed when the tissue damage happens. This combines with factor 7 in the blood, forming an active tissue factor 7A complex. This in turn activates factor 10 to be converted into an active 10A that leads to a formation of thrombin, or which is the factor 2A converted from factor 2, that's thrombin. This thrombin converts the fibrinogen or the factor 1 to fibrin, which forms the stable clot. The easiest way to remember extrinsic pathway is by remembering the mnemonic WEPT7, WEPT7, where W stands for warfarin, which is a blood thinner that inhibits vitamin K dependent clotting factors and causes delay in clotting. And E stands for extrinsic pathway. PT is for the prothrombin time. That is a test that measures the clotting time via extrinsic pathway. And factor 7, which is the key factor in the extrinsic pathway. Next, we move on to intrinsic pathway. The intrinsic pathway is otherwise called the PTT pathway or the partial thromboplastin pathway. This is activated by damage to the blood vessel itself, and it involves factors that is already present in the blood. So when the blood vessels get damaged, it exposes a collagen which activates factor 12. The factor 12 activates factor 11, which in turn activates factor 9. Then factor 9, with the help of factor 8, calcium and phospholipids, activates factor 10. And from factor 10, it's usually the common pathway where there is formation of thrombin, and then there is formation of fibrin, which happens with the fibrinogen getting converted into fibrin. The easiest way to remember intrinsic pathway is by remembering the mnemonic 10-8 or 10-8, where T stands for factor 12, E for factor 11, N for factor 9, and the numeric 8 for factor 8. To summarize, the intrinsic and the extrinsic pathways may be activated simultaneously as part of body's coordinated response to an injury. Both the pathways work together to ensure efficient and rapid clotting response to bleeding. The simultaneous activation of these pathways are very crucial for effective hemostasis, and that ensures that the bleeding is quickly controlled and the integrity of vascular system is maintained. Clinical relevance of PT and APTT values. In case there is a prolonged PT as well as PTT, that indicates deficiency in the common pathway or the deficiency in factors 10, 5, 2. In case the prolonged PT is noted, whereas not the PTT, that indicates a problem with the extrinsic pathway, that is probably due to deficiency of factor 7. In case there is a problem with the intrinsic pathway, only the PTT is prolonged whereas the PT is normal, and that indicates deficiency of factor involved in the intrinsic pathway, say factor 12, factor 11, factor 9 and factor 8. Some of the known coagulation disorders are hemophilia A due to the deficiency of factor 8. Deficiency of factor 9 can cause hemophilia B. Deficiency or dysfunction of factor 11 resulting in hemophilia C. Von Willebrand disease as a result of deficiency in von Willebrand factor and deficiency of factor 8. Vitamin K deficiency can result in deficiency of factors 2, 10, 7 and 9. Vitamin K is involved in synthesis of these coagulation factors.